Today I'm in health communication and I'm excited to be part of this webinar. Next slide. Okay. For some reason So today we will be quickly talking about defining what eHealth is all about. A little bit about mHealth, which is now common, current, one of the terms that are commonly used today. We want to talk a little bit on gender and health issues in the Caribbean, particularly in relation to ICTs. And from there, we'll talk a little bit about what we need to consider when we talk about women and eHealth. Next slide. So how do we define eHealth? This is a common definition that has been, you'll find it in almost every document, every research that focuses on health communication and eHealth. And basically, it's a combination of or utilization of information communication technologies to really transmit and store and retrieve some kind of digital data for clinical and educational purposes. Next slide. So when we talk about ICTs, there are many kind of gadgets and devices that are being used in terms of communication technologies. I use one of the definitions of UNDP. They refer to ICTs as innovations in microelectronics computing. That includes hardware and software used for telecommunications and microprocessing, and also use of semiconductors and fiber optics. In other words, this is all about telecommunications, how we use broadcast media, information management systems, audio processing, transmissions, and anything that's networked. You can use a combination of one or more devices when you refer to ICT use. Next slide. So ICT and eHealth have been, or rather, use of information technology has been globally recognized. Healthy People 2020, for example, does emphasize the use of ICTs, information technology, to improve population health, and that does not mean just in the U.S. or in the more developed world, but also in the less developed countries. The Millennium Development Goals also has underscored the benefits of using ICTs or information communication technologies in achieving not only gender equity and health and equality, but also in health, improving people's health. Next slide. So when we use ICTs for health communication or health information, that's where we now refer them to health information technologies, or HITS. Although this term doesn't always appear, but basically that's what it's all about. So really using these communication technologies for health purposes. And this has tremendous promise in terms of delivering not only the healthcare, but also health promotion and also behavior change, whether in developed or less developed countries. So use of communication technologies or ICTs it has a lot of benefits, and I'm sure if you look at most of the websites or other information or research, you see a list of them. Almost everybody talks about what are the benefits for it, and this is just kind of a summary of what has been addressed, and maybe this is not all. I'm sure I'm missing a whole lot more. But in terms of healthcare services, diagnosis and treatment, that has been there. It has been emphasized. Health surveillance in terms of research, and that has been there and has been established. Healthcare policy and decision making. So technology have played a major role and has actually been addressed in some of the healthcare policies and also IT policies. In terms of health literature, there's plenty of literature now that has come up in terms of using ICTs in health and healthcare. Healthcare marketing, we see more and more organizations really using communication technology to promote healthcare services, healthcare information, healthcare research, and everything else. Then in health education, knowledge, and also research, there's plenty of that being now used in terms of ICTs and HITS. So health communication, again, ICTs are right in the middle of health communication. So in regard to the Caribbean, mostly the Caribbean, there's plenty of ICT use in the region, particularly for surveillance. I think the first presenters just talked about research and the use of communication technology. That's a perfect example of what ICTs have been used for. But at the same time, they're also being used for medical surveillance. So they have also been extensively used in managing information systems, particularly in patient information systems. So that has been established over the recent years, and many more organizations and healthcare organizations are particularly moving towards that direction. Information dissemination has been there. Websites are everywhere. Almost every organization, regardless of the size or the resources, they've actually established a website but that is mainly for information dissemination. However, there's not a whole lot in terms of communication and behavior change, because in health communication we talk about information dissemination does not lead to that is not communication. It's really disseminating public information. So there is that need for behavior change, and there's that need for really communicating with the public. That is the direction that that is now being proposed. What that means is there's a need for more interaction with the audience. How can we use these communication technologies for organizations to interact with the audience that they are trying to target? And on the other hand, there's very limited audience participation. Besides the Facebook and the social networks, there's a lot more needed in terms of the credible organizations, for instance, the ministries of health and other government organizations or even non-profit organizations, to be able to give the people the opportunity to interact with the organizations, with other people in regard to the health messages and sharing the information. Next slide. So these are just examples of how eHealth applications have been applied. For example, I just mentioned websites, but also in regards to emails, message boards, chat rooms, that is also being used widely, and probably not so much in the Caribbean region, but it has been there in many other more developed countries. Online support group systems and networks and communities, that is kind of the in thing now, particularly in the more developed nations, because they have the capability and the systems to make that happen. And what that means is people can share their stories, they can network, they can support each other. And especially, you know, sometimes people are suffering from illnesses that possibly all they need is really to be coping with it. And that kind of social support helps, and interacting with other people in the network, it helps with the coping of with some of those illnesses. So the electronic health records, that has been now established, health decision support systems, tailored health education programs, healthcare websites and portals. I think all these are common, and we've seen them everywhere. Online gaming is now becoming a big thing, where it's not only entertaining to the people, but also it does provide the information and interaction that has been lacking in terms of health communication and health promotion. So the gaming by itself kind of puts the people, gives them the opportunity to interact with the message through the communication technologies. Next slide. So if used correctly, ICTs or HITS, they do have a huge potential in terms of increasing provider and also the patients access to relevant health information. So it is very important for them to have that access, because once the patient is at least have the information, then they are able to ask the right questions. They are able to at least interact and be able to inform about some of the issues that they're dealing with. If I could just throw in an example, some of the patients do not take the medication properly, or they do not adhere to what the doctors order, because they are not clearly aware, they're not knowledgeable about what they're dealing with. And that kind of interaction, if they can go online and seek more information, communicate directly with the doctor, then that way they have a better understanding. In terms of HITS or ICTs also enhance quality of care. They do reduce healthcare errors, and I think anybody can give examples of some of those errors where doctors make errors, patients make errors, and those can be eliminated through use of ICTs, because you can go online, you can talk to the other person in terms of discussing issues that you're facing. Other examples include the doctor-patient interactions. Sometimes you don't even need to go to the doctor. You can interact through the website or through other communication technologies. Patients get empowered, so they are not just there with the doctors to listen, but also they are there to participate in decision-making. And at the same time, it does encourage them to make or at least adopt health behaviors. So how do we define mHealth? This is again one of the concepts that has been promoted. And this is mainly because of the advance in use of cell phones and medical the medical technologies is now becoming more mobile. So, and what this means is people can actually use a wireless connection server, a personal server, which could be a personal computer, a cell phone, anything that you own in terms of the communication device, and really connect to the medical server. So that's what mHealth is all about. So however you use it, you're really communicating, you're getting in touch, you're accessing information, and it could be at the personal level or also at the organizational level. So if a doctor is in the somewhere in the rural communities, they can actually connect to the main server at the hospital to be able to access the patient records. And so basically this has been kind of the direction that in terms of telecommunication that the medical field is going. So this development is being driven again due to the mass markets for cell phones and also other portable computing devices. And possibly in the next few years, this is possibly where the eHealth will be headed. Next slide. So in terms of the Caribbean, there is again a whole lot of potential. I pulled out some of the data from the documented surveys, and so in the Caribbean generally, medical technology is expanding and rapidly. Again, due to the penetration of only the web, the internet, but also the mobile telephones. So there is, especially in Jamaica, for example, mobile penetration has more than 100%. There are people who have more than one cell phone. And that's a good thing in terms of eHealth, although internet is still dragging, particularly access to internet at home. But when you look at the other, in terms of portable and other cell phone technologies, then that is a good opportunity for at least for mHealth in the next few years. So these are just other examples that I pulled from one of the documents of, and again, it's not every country that has this kind of data or current data. So these are just examples of what has been documented. Every country has it, but some of it is a little bit outdated. But this gives you a little bit of examples of what you're talking about in terms of penetration. If you look, for example, in Barbados, access to internet at home is almost 70%. Suriname is a little bit computer penetration is not as high. So, and this is basically what you're referring to, that we have the access, but mostly, although not so much for internet, there's quite a bit in terms of mobile and internet. Yes. So in terms of digital technology, there are some divide issues that we do need to talk about and communicate about when we're addressing eHealth, and that includes things like age. We are dealing with an age that is more high tech. They have access to all kinds of gadgets. They are educated, but it's not everybody who is at that level. So those kind of gender and age differences need to be taken into consideration. Other issues in terms of income. Although everybody has a cell phone, it's not everybody who has a smartphone. And those are issues that has to do with how much they can afford, and in terms of credit and bills and costs. And these are things that we do need to talk about. Issues of disability access. When you're using computers, for example, is it everybody who can access and who has who can read, because we have people who have disabilities. How do we need to incorporate that? So that issue of access, for example, organizations need to be considerate about that. Then there is issues of literacy and low literacy. My research, especially in Jamaica, shows that although people are very literate, when it comes to computer technology, it's not everybody who is at that level, and that needs to be considered as well. And then there is obviously the geographical region. Although we do have internet access, the connectivity in some of the regions might not be as good as other regions. And those are, again, issues that to be taken into consideration. Next slide. So ICT usage in the Caribbean, and you can see they've really tried in so many other areas. However, I highlighted health there because there's still very limited usage of ICTs in eHealth. And that is, again, why we want to emphasize a lot more on what can be used. So when it comes to gender and health, this is very important because we do have many issues. As the first presenter touched a little bit, there are some gender differences in terms of access and use of communication technologies. Women in the region are more likely to suffer health issues, again, in terms of, for example, HIV, AIDS, diabetes, and many other lifestyle diseases. Research has shown that more women do have issues with HIV and AIDS, particularly due to gender and inequality, so they're more likely to be infected. Women are also less likely to have access to preventive health care. And again, this comes back to income, access to insurance, and also because of stigma and discrimination. Next slide. So based on that little background on health and women, there's also the issue that ICT, when we use them, they are not also gender neutral. So they do have their differences in terms of how we use and access ICTs in regards to gender and communication. So previous studies have shown that women are more likely to search for health information. This was emphasized earlier. Women are more likely to use the ICT for social networking. This was also pointed out earlier. There are also women who are living in less developed countries, although they are less likely to own a cell phone. When they do have one, then they are more likely to use it mostly to connect with the healthcare and also to feel more empowered. And that's basically why it is actually important to emphasize on use of these ICTs when they have access to the cell phones. So when they do have access to ICTs or communication technologies, most of them, they do have access, especially the internet access at home, and that the reason is because they not at home but at work, and they do not have a whole lot at home. And however, even at work, it's also limited because of the kind of work that they are doing. I think if you and some of you probably are aware of that, call centers, for example, they have lots of women working there. Other in the offices, most of them are working as typists, word processors, data entry clerks. That does not enable them to really have a real knowledge about IT use. Sometimes even the internet access might be limited. So women also do have limited IT training because one thing when I did my research in Jamaica, for example, results show that there are actually more women who are in the IT doing IT courses as opposed to women. So women are not very computer literate, and that also affects the way they use ICTs for health purposes. So specifically, some of the gender considerations that we need to be considerate about include the gender policies, the components in the IT policy that has to be addressed and incorporated. Then there's the issue of ownership. Who really owns the hardware or the software? Because if somebody owns it, how much can a woman use it, and to what extent can they share or at least or even have access to the information that they need? Training and capacity building, access points. Do they have access? Is it at the private sector or public sector? Do they go to the public library? So those kind of issues. Then there's cost and capability. How much can they pay for it? If it's a phone they're using, how much data can they download? All those are issues that to be considerate about. And then we talked about computer literacy, and there's research that shows that there are a whole lot of women who suffer from technophobia. They see that as too daunting for them. The issue of participation, that has to do with how much a woman can share, participate in the healthcare communication. There are lots of issues in eHealth when it comes to privacy and confidentiality, especially when you're suffering from some of the stigmatized illnesses or diseases. For example, when you have somebody with HIV, that's obviously a stigmatized disease. How do you really share that information online or with other people? And that has been an issue with eHealth. Then there's ethical issues in healthcare. The extent to which a woman can be really confident that whatever they share with a medical doctor or healthcare person is not going to be shared with other people, and there's those kind of issues that might be of worry to a lot of people who might want to use them. Then there are obviously security issues in regard to IT access. Where do you share? If you use your cell phone and you share some information and somebody discovers that you have HIV/AIDS, are you really secure? Are you really safe? Or is it likely that you might be abused because of that kind of information? So a few things to consider, and I think this is the last slide. When you're using eHealth in terms of communicating about women and health, there are issues that to consider when it comes to really asking questions like, can they really understand how to use the communication technologies? So regardless of the device, whenever we use it, keeping that in mind. How comfortable do these communication technologies fit within the policies and practices? So that is very important, because it's not just disseminating information and asking people to use them, but looking at how do they fit overall. How affordable can they be? And again, in terms of cost and capability, that is important. Are the messages delivered through health easy to enough for them to understand? And again, some of the information disseminated might be too technical. So really making that information easy enough for the women on the other side to be able to really understand it. And that has to do with the language used and also the terminologies used. That has to be easy enough for people to understand it. Again, really being able to consider issues of adaptivity, how much they can interact, and also considering that are these devices self-correcting? If I make an error, can I go back and erase it? Can I change that? Or is that information going to go out the way it is? And I think each one of us has had issues, regardless of what level of education, where you put in something online and you want to pull it back, but you're unable to do that. In terms of eHealth, that's a more serious issue that needs to be addressed. Then finally, the information that's going there through the ICTs, It needs to be really interesting to the people that you're targeting. In this case, if you're targeting women, can they see this information as relevant to them? Can it be engaging to them in terms of so that they can engage and participate in the process? And so those are some of the considerations that we do need to take care of. And I believe that's the last slide. Thank you very much.